Hello, welcome everybody. Um, we are here together on the Idea Early Career Researchers Talk. My name is Ansha. I am the host for this monthly discussion forum, inviting early career researchers to various early career researchers to initiate discourse on some interesting topics that can help us to elevate our understanding on workplace accessibility and inclusion. I am a postdoctoral researcher at Queen's University under the supervision of Dr. Daniel Samos and supporting the IDEA Incubator Hubs 3. Currently, I'm researching on disability inclusive mentorship for transition to work and career success of persons with disability. I'm also interested in researching on the health and employment outcomes of injured workers with acquired disabilities. Please note that we are recording this session and the recordings will be made available on our IDEA website. For those who may not know about what IDEA is, it's an acronym for the Inclusive Design for Employment Access. IDEA is a social innovation hub focused on creating a stronger and diverse labor market that is inclusive and accessible for persons with disabilities. IDEA researchers and partners engage in developing various evidence-based tools and resources through a co-designing process. The vision of this innovation hub is that these tools and resources would help to advance workplaces capacity for recruitment, hiring, onboarding, retention, mentorship, and promotion of workers with disability. Thank you for joining us. Today, I'm hosting Ronessa Dass to speak on a topic that is brain fog and chronic pain in workplace. This is a very interesting topic, rarely addressed mostly in the workplace discourses for inclusion and accessibility. Ronessa is a second-year joint PhD candidate in rehabilitation science at McMaster University. Her research work is funded by the Capacity Building Initiative from the Chronic Pain Center of Excellence for Canadian Veterans. Ronessa also worked as a research assistant and with an idea and there have to supporting various projects. Ronessa will guide us to understand and engage with critical thinking about what chronic pain-related brain fog means and how it might have impact people's participation in the workplace and why it is important to consider when providing employment support for persons with disability. She will also share preliminary strategy on how workers experiencing brain fog can be supported in the workplace. From what I review, Ronessa is an emerging scholar and a passionate young researcher. I'm so excited to learn about your research. Ronessa is here with us today, grounding our understanding about brain fog and supportive strategies. Housekeeping for all the audiences. After our speaker talk, I will lead a discussion session using questions that I am hoping to receive from you, our audiences. Please use the Q&A function at the bottom of your screen to post your question, reflection about this topic. And you can paste or post your question while the presentation is underway, or you can wait until the Q&A session starts. Ronessa, thank you for joining us today to speak about your work, and I will now turn the stage open for you to start your presentation. Welcome.
Awesome. Okay, thank you so much for the introduction, and thank you everyone for being here and for the invitation. I'm really looking forward to today's discussion. Before we get started, I just wanted to start with a land acknowledgement. So McMaster University recognizes and acknowledges that it is located on the traditional territories of the Mississauga and the Haudenosaunee Nations and within the lands protected by the Dish with One Spoon Wampum Agreement. And as a second-generation Canadian, I'm grateful for the opportunities I'm afforded to this land, while also recognizing that they're only possible because of its history of injustice. So I aim to be respectful of this history by giving more than I take. A few disclosures before we get started. So as was mentioned, I'm currently a joint PhD candidate in rehab sciences, along with a master's of OT student. And so my research actually doesn't explicitly look at employment. It actually looks at brain fog and within a healthcare context for veterans with chronic pain. And it's funded by a capacity building initiative from the Chronic Pain Center of Excellence. But we have thought a bit more broadly about what other contexts might this be prevalent in, as well as what other populations. And as mentioned, I also work as a research assistant for Hub 2, so we'll share some of our preliminary Hub 2 findings in terms of how they relate to this work. I'd also like to give a thank you to the chronic pain community, to the School of Rehab Sciences, to the CPCOE, the Hub 2 team, and to my lab for all of their support throughout this process. And so just a brief overview for today. We'll first talk about what chronic pain-related brain fog is. We'll next talk about how it's addressed in the workplace. We'll talk about why it's relevant to think about, as well as some recommendations. So starting off, what is it? And we'll start broadly with chronic pain. So chronic pain affects 7.6 million Canadians, and pain isn't just physical, it also has mental, emotional, cognitive, and even social impacts. And collectively, these can influence how people do their day-to-day activities and can also reduce quality of life. And the cognitive impacts of chronic pain tend to be one of the most overlooked symptoms, which brings us to brain fog. And in its simplest of forms, it's defined as a state of mental cloudiness associated with issues with thinking, attention, and memory. And here we have a much more complicated definition of what it is, but I'll break it down. So it has four key pieces. So the first here is fluctuating. So this means that it's different from things like mild dysfunction or dementia or Alzheimer's, which is typically talked about in relation to pain. And it means that it also tends to be categorized or thought of as an episodic disability or an episodic experience. The actual feeling of it is often described as sort of this mental cloudiness that is associated with cognitive and emotional impacts. So it might be things like having difficulty paying attention, remembering, or word finding. And these can be quite frustrating and anxiety inducing. And collectively, they can also influence how people participate. So if I'm having trouble paying attention, I might struggle in a work meeting. And I just have a quote here from a person with lived experience to show how brain fog affects how he views himself and how in his day to day. So, I have a degree, I've gone through many difficult educational training scenarios. And now with brain fog, it can be a challenge to even get up during the day and meet the expectations of making an appointment on time. And because of this, I get these feelings of inadequacy or failure, all because for whatever reason, I can't remember something or forget something at home. And last, within my study, we also saw that there were some differences in terms of gender and how brain fog was experienced. So, women veterans in my study described having a huge strain on their identity because they were unable to do things like manage their health, along with other competing responsibilities like taking care of the children, household responsibilities, and going back to work. And men in our study describe offloading a lot of these tasks to their women spouses. And from a traditional gender role perspective, we know that these are roles that women tend to take on, and they often don't have anyone that they can offload these tasks to. And in fact, when we asked women which management strategies they use, most didn't describe the use of any and instead advocated for the development in future work. So in the next few slides, we'll talk about how is chronic pain-related brain fog currently addressed in the workplace. And spoiler alert, it's often actually not addressed, but there's a few reasons for this. So, one, brain fog is not a diagnosed condition. It's more so described as a cluster of experiences or symptoms, and typically diagnoses are key for accommodations. Brain fog is also an invisible experience embedded within other invisible experiences, and there is a stigma associated with that, and particularly when it comes to cognition, because people often tie that to intelligence, and they don't want to be perceived as less than because of their cognitive abilities. And just a last potential reason is that brain fog isn't very well understood. So people don't always know what you mean when you use that term. And so they might attribute it to a personal failure rather than something that can be related to a healthcare condition. And when we think about how to address chronic pain in the workplace, within research and in healthcare, we often talk about this biopsychosocial approach. So recognizing that pain isn't just physical, but it has these more widespread impacts. But when we actually think about how it's addressed in the workplace, most recommendations are really only physical. So they're things like minimizing repetitive movements, posture changes, modifications to the environments to reduce physical demands, and oftentimes these psychological and social pieces aren't really addressed. More so, there has been information on the psychological pieces, but it's not always explicitly tied to pain or explicitly tied to that physical piece. So it's really missing that integration, which is key for chronic pain. And the social supports tend to be most often completely neglected. And where brain fog falls is typically within the intersection of all three of these components, which is why in the next few slides we'll talk about why it's important for us to be thinking about it within the workplace. And so I'll present four main arguments as to this. So without accommodations at work, pain and brain fog might lead to lost wages, reduced access to supports to manage pain, reduced social interactions, and a diminished perception of self. And I'll describe arguments for all of these, or I'll describe examples for all of these arguments in the next few slides. So first, pain is expensive. In Canada, the direct cost of pain treatment for the healthcare system was $38 billion in 2019. And this is pre-COVID, pre-inflation, so it's likely that this number is higher. And this is also just what the government spends, but individuals might spend $1,000 to $4,000 per year out of their own pockets to manage their pain. And again, this is a problem because chronic pain disproportionately affects those from equity-deserving identities, including those from lower socioeconomic statuses. And I just have two quotes here to help to illustrate this point. So here we have a veteran who shared that people have tried to go back to work, but there's this perception that companies can't afford to be accommodating. So on top of having to navigate your health and your pain, you also have to navigate financially, not knowing where your income will come from. And here's another example from a healthcare professional who shared that they currently had three patients on their caseload who just kept asking, when can I go back to work? Because financially, they were in a really bad place. But from the healthcare professional perspective, they didn't think that they were at a place or at a point in their care where they'd be able to sustain going back to work. But people actually, they do need to go back to work because for many people, going back to work is actually how they manage their pain. So for pain, our first line treatments are things like rehab services, so physio and OT, and these often aren't covered by provincial healthcare plans, and they're most commonly obtained through private insurance plans from employers. However, access to pain management appointments typically occur during typical work hours. So to illustrate at this point, we have a veteran who shares that they went back to work, but only lasted 30 days because they weren't able to attend the medical appointments used for pain maintenance. So these last two examples show how people are being put in these really impossible situations. So they're having to choose between managing their pain along with getting money to survive. And this is unfortunate because, as we'll discuss in the next section, there are often very feasible and sometimes easy to implement solutions that can address this. So, on a slightly different note, employment is also a helpful management strategy for some people, and it can also help to improve social interactions and social abilities because for many people with chronic pain and brain fog, they tend to have reduced social interactions, which can lead to worse quality of life and mental health symptoms. And employment can support with this because, on average, individuals spend about 30% of their waking time at work. It's also associated with lower levels of loneliness, and it can help to provide a sense of social fulfillment. But as mentioned, social interactions can be a lot more challenging when you're experiencing brain fog. So I mentioned that people with brain fog might have trouble dealing with emotions or regulating their emotions. And at work, this can be particularly challenging because even if you're in pain or even if you're experiencing brain fog, you still have to be sociable and professional. So you kind of have to micromanage how you're reacting. And for some people, this sort of micromanagement of themselves can actually be very exhausting and can hide in their feelings of brain fog. And then another piece is that that stigma piece that we talked about. So people might hesitate to go back into the workplace or to have social interactions and to be around others because they're not sure how their brain fog will be perceived. So if they try to say that I'm experiencing brain fog, will they be perceived as being funny? Or will they be perceived as being lazy and not wanting to pay attention? So these are these challenges which can make social interactions a bit more difficult for people with brain fog. And this last piece here is on diminished perception of self, which we talked about in the last few slides, and that brain fog can affect how people view themselves, and employment is often tied to people's identity. And so, as this veteran shares, if I work too little, I get depressed, and I feel like I'm not contributing to the world in the same way that I used to. But also, if I work too much, then I get anxiety. So it's important to note that employment, of course, isn't the only source of social fulfillment, but it is particularly a key one, especially in Western society. And it was also particularly prominent in our study because for veterans, employment was a very central component to their identity. So, for those of you who are unfamiliar with veteran culture, there's often this term called military identity or military mindset, which is something that is very deeply embedded within their initial training, and they tend to carry that throughout their career, along with when they actually reintegrate back into civilian communities. And to use a pop culture reference, it's sort of similar to how surgeons are portrayed in Grey's Anatomy in terms of that employment being very central to how they see themselves and also part of their social circle. And the last piece is that even though employment isn't the only sense of social fulfillment, it's all really about autonomy and opportunity because if people would like to work and if they have the capacity to do so, then they should absolutely have the choice to be able to pursue employment. So that brings us to our next discussion for the day, which is how can brain fog be managed in the workplace? And I'd just like to preface that at this point, my research really hasn't looked explicitly at management strategies, or we haven't actually tested any yet. And also, to our knowledge, what we have collected so far is more so healthcare supports, and there hasn't really been a lot of work looking at how brain fog can be supported in the workplace. So, we'll share some of the strategies we've created and the ones that we think would be relevant to workplaces. But it's important to note that some might not be relevant to all workplaces, and some might not be relevant to all people because brain fog is fluctuating and episodic. But this first strategy here is one that I think is relevant to most situations, and it's compassion. Because generally, when people feel understood and supported at work, they're more comfortable to ask for help. So it's very important that we show our colleagues compassion. But it's also key that we show ourselves compassion and not hesitate to ask for help because brain fog is fluctuating. So there are good days and there are bad days. So it's key to show yourself grace during these bad days. And this importance of compassion came out through some of our preliminary Hub 2 findings. So we're currently finishing up a study looking at the supports employers need to hire and retain workers with disability. And many employers actually describe using a compassionate approach. So for example, here's an employer who shared using things like training programs, participating in different awareness months, and really just having embedded continual learning within their workplace to really create this compassionate and inclusive workplace culture where people feel supported and welcomed at work. Another strategy can be activity modification, and this is already talked about in terms of the physical impacts of brain fog, but there are opportunities for the cognitive challenges as well. So, for example, people describe feeling brain fog more at the end of a long workday or when they're more physically and mentally exhausted. So, trying to minimize activities that can be exhausting or trying to spread them out throughout the day could be helpful. People also describe feeling brain fog more when there's kind of a lot going on in their environment. So, if they're trying to multitask, if there's a lot of people talking at once, or people often describe feeling it a lot in places like Costco, where it's just a very hectic environment. So, limiting external stimuli as much as possible, especially if you're doing a task that's a bit more challenging, might also be helpful. People often describe using things like cognitive support, so things like calendar reminders, sticky notes, journaling, and think out loud strategies. And planning can also be helpful because having some sort of planning done or having some sorts of routines can actually reduce the decision load you have throughout the day. And some people have described actually integrating planning into their work schedule because it was so key for them and it was so helpful. And they describe that when they're doing that planning, they also try to think about what are the emotional, physical, and cognitive impacts of the task that they're doing. So, for example, people might feel brain fog more at the end of the day, so they tend to do strategy or tend to do tasks that are more cognitively demanding at the beginning of the day. Some people have also described knowing that they experience brain fog a lot after a busy work meeting, so they actually plan their breaks for after that meeting so that they don't overexert themselves. And this last point here is one that I think that many of us could probably resonate with, and that sometimes we have these amazing, well thought out plans, and then they simply don't work the way that we'd like them to. So it's also key to have flexibility in these plans, recognizing that brain fog is episodic. And that brings us to our last piece around flexibility, because everyone's experiences with chronic pain and brain fog are different, and even people's experiences day to day might differ. So, strategies like flexible hours can be helpful. So, for example, for that veteran who couldn't go back to work because they had a strict 9 to 5 and they couldn't go to their physio appointment, perhaps if they were able to have an 8 to 4, or maybe if they had a break throughout the day where they could go to work, go to their appointment, and then come back to work, then they'd be able to both go to work and manage their pain. Another strategy could be remote work. So typically when people work from home, they have a better control over their environment. They can limit distractions. They might be able to take a rest throughout the day if they need to do so. And they just have more control and opportunity to be able to manage both demands, both professional and personal. And it's also important that when we're thinking about flexibility, that we actually have infrastructure and policies available to allow room for that. So I'm sure we've all been in a situation where we might have encountered a very rigid policy. And if we actually take a step back to critically examine why that policy exists, sometimes it doesn't actually make sense. And sometimes they don't actually contribute to better outcomes in the workplace, but instead they're inherently ableist and they continue to put people in difficult situations where they have to choose between employment and choose between their health. And this importance of flexibility also came up in our Hub 2 findings, with several service providers describing that generally when they work with smaller organizations or just organizations that are a bit more flexible in general and that don't have this red tape, that they're able to provide accommodations a bit smoother, and that typically it also leads to better relationships between employers and employees. And so, no matter what strategy you're using, it's also important to consider an intersectional approach because people are often coming from more than one identity. So, they're not just experiencing chronic pain and brain fog, but they might also be experiencing other challenges and other just general opportunities in life. So, for example, we described how there might be gender differences based off of brain fog, and we also know that there are gender differences in the workplace. And if you're interested in learning more about the importance of intersectionality, I encourage you to read this other paper, which just came out of Hub 2, which looks at employment supports for racialized disabled workers by Aiken Gruel. I'll just leave the QR code here in case anyone's interested. And so this last piece here, this is our more novel findings that we actually just submitted for peer review yesterday. So I asked that you don't take any screenshots yet, but I did want to share it to show kind of the next steps and what we're currently working on. So what we've created is a theoretical framework of brain fog, which has the impact strategies and triggers. And what we're hoping for it to be is actually a tool that people can use to identify possible impacts or triggers for them to help them to figure out or to help them to better describe their experiences with brain fog and identify strategies that can work for them. And so far, we've really only thought about it within a healthcare context, but in doing this presentation, I've really thought about how it could be applied to other contexts like employment. So if you have any suggestions on how this could be tailored or how this can be used in the workplace, or just any kind of questions, recommendations in general, we'd love to hear them because I believe that it's through having these conversations and it's through raising awareness that we can help to clear up some of the fog and help to support people with this experience. And I just have a slide here with a few other resources, so a few of our peer-reviewed papers, as well as some talks that we've done, as well as some references here. And that is all I had prepared for you all today. So I'll just stop sharing my slide, but I can bring them back up at any time if anyone has any questions.
Thank you. That's terrific. Very wonderful presentation, very insightful. That opens up our understanding about what brain fog is and how can we understand the challenge of people who are experiencing brain fog. With I like the way how you frame it. Though your research is more healthcare focused, but you fit this presentation for how can this knowledge, this understanding be transferable for workplace contexts, and also because people are not, though they are sick, they have other aspects of life, work, and that needs to be well understood in their workplace contexts. Very insightful. Thank you very much for this presentation. We have some questions posted in the Q&A. One of the questions is actually linked to what I have in my mind as well. As this brain fog, chronic illness, and return to work aspects are highly linked to what I am doing as well. One of the questions from our audience is, doesn't a biopsychosocial perspective ignore the cognitive aspects of the person? So this, with this, you can think this question, it is linked to my question as I mentioned earlier. There is a wider other aspects of human or the person in our life. So what other various types of our life domain, for example, the spiritual aspects of the person, or and other self connection aspects of the person. You mentioned that actually they might lose their self-worth and when they experience this problem at workplaces. So you might address that, how the biopsychosocial framework might address or might might have a gap as well. Just reflect
Yeah.
how you perceive it.
Yeah, that's such a great point. That's yeah, because it's the cognitive pieces aren't explicit in that title there with the biopsychosocial. I think that when people typically look at it, then they're typically put the cognitive under the psychological, but there are some critiques with that because it doesn't quite exactly align. I think the intention of the biopsychal approach is to take this holistic kind of look of pain in general, and I think we also recognize some of those limitations with the biopsychosocial approach, which is why we decided to make our own theoretical framework to explicitly look at the different pieces of brain fog. But I think it's also important to note that the framework isn't the only model out there. There's also a biopsychosocial spiritual one. And people also often tend to use ones like the ICF, which provide a more broad look into different factors as well.
Thank you. I think there are many other, when we speak about how can we holistically address the needs of those workers who are experiencing brain fog at workplaces, we can think of this holistic framework
Yeah.
that might address the cognitive, spiritual, biopsychosocial, all those components, so that in your future plan as well, you might think of that kind of holistic approach.
Yeah.
That may be one of the contribution where you can
Yeah, that was a
consider.
great point. Thank you for raising that.
Yeah. And the other question that we have on the Q&A, continue our audiences, please continue posting your reflection question on the Q&A function. We have a lot of time to discuss here. So we will unpack a lot of concepts here. So they have appreciated your presentation. It was a great presentation and thank you. But they want to understand if there are any guidance or suggestions for senior leaders of organizations like CEOs, board members or high-level leaders. Are there any specific things you think they can do to support? So you can, in my understanding, you can address this either to help their employees, like they are senior managers, senior leaders of the workplaces, so that to help their employees who are experiencing brain fog and chronic illness. I think that's the concept that I have understood. And so
Yeah.
you can see the question and address this.
Yeah, that's a good question. I'll just again preface so that we haven't actually explicitly looked at it within employment context yet. But I think that actually that piece around flexibility or having policies that actually allow room for that flexibility is really key, particularly because I think one of the things that people struggle with chronic pain and brain fog in the workplace is that it is very sometimes episodic. So sometimes, people they can generally manage their pain quite well, and then they'll experience something like a pain flare. And then some people might struggle to understand that because they'll think, oh, well, you were fine for these few days before. Why are all of a sudden are you experiencing a pain flare? So I think sometimes employers might struggle with that. There's also the piece that pain management can also be tricky when when you're in the workplace because sometimes physio clinics are open at like a 9 to 5. So I think having flexibility, whether that's allowing people to work from home on the days that they're experiencing pain flares, allowing flexible hours so that they can attend their workplaces, or just kind of generally understanding that if sometimes somebody's, in pain, maybe that's not the best time for them to be speaking with a bunch of clients, or just allowing room and compassion in those spaces, I think is really important. And maybe even kind of critically examining some of the policies that you have in your workplace and think about, is this policy one that's helpful, or is this one that's actually preventing people from engaging in work in a way that's meaningful for them?
And yeah, similar appreciation here from audiences. I think the figure and your they're suggesting that your figure, the triggering about brain fog trigger and impact could make a great awareness building resource
Thank
for
you.
managers. So you might share that the next question, the next reflection as well. I
Yes.
just try to share more of this evidences, these resources
Absolutely. Yes.
for
As soon as it's
practitioners.
available, I'll share it with
Yes,
the network.
try to share that. And there's one question. Do you think certain workplace might be better able to address brain fog? You have been mentioning remote work. How could remote work can help for people who are experiencing brain fog? So you might reflect on this question.
Yeah. Yeah, sorry, which one is that? I'm just
And
looking
last
through
one, do you
the
think
last.
certain workplace might be
Yes.
better to address brain
Oh,
fog.
yes.
How does that be
Yeah.
addressed if we are thinking remote work as one of the
Yeah.
strategy?
I think that remote work it can be a good option because people might have better control over their environment, so they might be able to reduce distractions. But also sometimes people said that if they just, take a quick nap or use an ice pack and try to do something to relieve the pain that they're feeling, that which might be heightening their feelings of brain fog, then that it allows them to then go back and to be able to work on their tasks. So I think it's again about that flexibility that remote work
Mhm.
provides.
I like that flexibility. And
Yeah.
when we are approaching this supporting for employees with who are experiencing brain fog with compassionate
Yeah.
like framework, then we'll be able to understand what do they need. Do they need to
Yeah.
work at home? Do they need some flexible adjustment, like accommodation at workplaces? Maybe they're like I see connectedness I mentioned from personal, social,
Yeah.
other spiritual and nature connections. So where can they get disconnectedness? Like where can we maximize disconnectedness? Maybe that's the best place is in their workplace or at home. So when we
Yeah.
approach it compassionately, I think we'll be able to
Yeah.
understand. So the tools and resources that we are producing, or the policies also need to
Yeah.
be aware of this flexibility, so that we
Yeah.
can address the individual, personal,
Absolutely.
person-centered
Yeah.
care for these
Yes.
people.
And in our model, what we've tried to center is right at the core of the model is the person with lived experience. And we use that was intentional so that we could highlight that everyone's experience are different. And we really have to think about all of these different features with the person in mind and taking these very
Yes,
individualized approach. And I feel like sometimes people don't love individualized approach because sometimes there's this impression
yeah.
that it means that there's more work to be done or that it'll be easier if you could, of course, apply the same strategy to everyone. But unfortunately, that's just not reality. And that's often not what we're doing in the workplace, anyways, even if it's with a worker without a disability.
Hmm, interesting. Um, Actually, I think in your future plan,
Mhm.
you have indicated that you are under like you are developing something to support healthcare providers and
Yes.
also workplace communities to support these persons who are experiencing brain fog. But there could be some misinterpretation. Like it's quite
Hmm.
common to misunderstand what is that person experiencing really. When we go to the
Yeah.
workplace, managers, supervisors might perceive as it is a performance problem, while the person is struggling to manage their task because of their brain fog
Yes.
challenge. So, do we, in your study, you have done scoping review and you're doing some other studies
Yes.
as well. Were you able to identify some resources or measurement scales to identify whether it is like early signs of
Yeah.
like this chronic illness or brain fog, or like so that we can promote that tool resources for employers or place practice to help those work if
Yes.
you have any.
So we are actually developing an assessment tool right now. That is one of the stages. We're actually just finished up a Delphi consensus study where we were identifying items for that. And I'm just right now trying to get in the ethics to actually test out that tool. But that's what we're working on right now is a tool that'll be able to identify that.
Interesting.
Mm.
Yeah. We have one more.
Yes.
Okay, one more question. Was there any information how the veterans were treated within the military? Um, was their
Yes.
brain fog experience respected? Did they experience any stigma? Was there any good social support system within the veteran system or in the military? Just
Yeah.
reflect on that.
That's a great question, and it definitely varied by a few different factors. So I think it varied based off of when they were in the military. So some were in the military decades ago, so they really grew up at a time where there was a lot of stigma within the military around PTSD and around mental health and invisible experiences. So they tend to some of them tend to still kind of hold some of that internalized stigma, and we're really working towards undoing some of that. And then there were some that were they came up at the time where the military had then recognized PTSD or they were exposed to a lot of different peer support groups for PTSD and they had a lot of friends and family members who were able to provide those social supports. So I think it's slowly getting better, but there are definitely some residual, I think. There might be a bit of residual stigma still there.
And I hope one of the learning from what you're doing, from what I listen and also review your work, this has a focus more on a veteran
Yes.
group, right? Do you see any kind of like a transferable understanding for the contemporary workplaces, other civilian
Yeah.
workplaces, so that we can do more improvement in that area?
Yeah, absolutely. So the veterans that we were speaking to, so they had already left the military, so they were already working within civilian jobs. Yeah, so when they're talking about their challenges with the workplace, they were most so talking about it within the challenges of civilian workplaces. But it was just the piece around the veterans is that culture piece there. So because they kind of have that culture of the mission first and the self-last mindset, sometimes that makes it harder to kind of explain that you're experiencing a health issue because you feel like you're there to support other people, so you don't want to talk about your own issues.
Interesting. One interesting question that I see in the Q&A.
Mhm.
What makes it? What triggers you to study this topic? They have asked that. How did you
Yeah.
want to study this subject?
Yeah, so my mom experiences chronic pain from a previous injury. So I've always been really interested in chronic pain, particularly within the cognitive impacts because I did my undergrad in cognitive science and I noticed that my mom was experiencing chronic cha or cognitive challenges from chronic pain, but we didn't really see a lot of supports around that within when we were talking to our healthcare professionals. So I got really interested in that and I ended up working with my supervisor, Tara Packham, who also thought that it was an interesting topic. And then we came across this grant from the Chronic Pain Center of Excellence. And we thought that this was a great opportunity because one, veterans are more likely to experience brain fog because they are more likely to experience multimorbidity, so things like chronic pain and mental health. But also, a lot of invisible experiences first get legitimized within the veteran population, so like PTSD. So it was really just a nice opportunity to kind of do a win-win for everyone.
Hmm. Interesting. I'll come back to the other question on the top, but one of the last the question that posted at the end is you have shared about healthcare, like healthcare and workplace contexts. Are there other contexts where this work, the evidence that you are generating, the resources can be applied to support like people with brain fog may not be only in the workplace and in
Yeah.
healthcare? Is there any other contexts where these people can be
Yeah, so something
supported?
that I would really love to do and that I'm hoping to do as the next stages of our study is really look at it within the family context. Because oftentimes, or for example, the women in our study described that they were kind of put in a very difficult position because they kind of had to start relying on their children for a lot of stuff. And so it started to then affect their family dynamics. So we really think that'd be really interesting to look at it within a family context and to see if there's anything that we can do to help people within their family roles because
Mm-hmm.
that's such a big piece to people's everyday and to how they view themselves.
Very interesting. Thank you for bringing that lens because when these people were considering their working age population, mostly
Yeah,
just like when we think of workplaces, they are working age. So they have families, they have other social networks
yeah,
that might be impacted because of their work disruption, because of their
yeah,
illness, their health challenge. So considering that as both as to understand their quality of life, changes in their life, and also to use that as a source of as a resource to support their recovery and also to manage their chronic pain
mhm,
and improve the quality of life of these people. So it would be very interesting to see that work progressing from
yeah.
your end. I love that that concept.
Yes, we'd love to do that. I think that'd be really
Yeah,
fun. Mm.
yeah, that would be very, that will cut out more the full scopes of the social connections. There are
Mhm.
workplace social connections, there are family connections, there are other
Yeah,
policy aspects as well. So that will, we will try to address that full domain of the social connections through addressing their families as well. So
yeah,
the other one, you have done other research. So can you share us where can we get your other work? So I mean, like
yes.
this work is so well done. Wondering where
Thank
I can
you.
find your other projects as well. Maybe if you
Yeah.
can tell our audiences, like inform our audience where they can access your work. those
Yes.
published or unpublished or other ongoing projects?
Yeah, so we have three or four around this that have already been published. So I think you can find them. They should be available on my Google Scholar and my LinkedIn. We also have done different talks and different podcasts around it as well. And we're currently wrapping up a few more studies. So we should have more in the works and available to read as well. And I'd be happy to share them all with IDEA or with anyone who's interested. And I always post everything on my LinkedIn. So happy to connect with
LinkedIn.
anyone there.
Yes, I connected with you. I will have the right
Yes.
contact. Nice. And the other question, very interesting question actually. Were there any urban-rural differences in in the experiences? I have one other question as well. Did you see other intersectional factors that
Yeah.
could be one of the living residents, as this person mentioned? Also, what other intersectional factors that we need to understand so that we can any difference that you have observed that might
Yeah.
contribute? Yeah.
Yeah, that's a great question. So we didn't explicitly look at any rural or urban differences. So I didn't see any, but I guess kind of anecdotally, what we've seen people talk about or heard people talk about was that when you're in urban centers, you typically have better access to services, so different healthcare professionals, but also different social services and even kind of community support. So sometimes it was easier to regain a sense of self and easier to manage your pain once because you have access to all these different supports. And people from rural areas often didn't have that piece. I'm just looking at a figure of intersectionality to see if there was anything else. Oh, age was one as well. This didn't come from my work explicitly, but it came from some of the discussions with patient organizations that we've had, and that people who are younger and experience chronic pain and brain fog typically people don't often take them seriously. So they think that, oh, you're too young to be having pain or you're too young to be thinking
Mm.
like this. So those are the groups that tend to be seen more as the lazy and unproductive. So those are the ones who I think it'd be really important to do an explicit study on younger adults experiencing brain fog as well.
One other aspect would be the workplace context
Yeah.
in terms of like small businesses and large scale industries and
Hmm.
service sectors versus
Yes.
manufacturing construction sectors might have a difference. And so that's one other area that we might see. We might
Yeah.
observe some differences in terms of support. Access to support could definitely vary across those employment sectors.
For sure,
And
yeah. Because yeah, even like if it's a fast-paced work environment where they might not be as accommodating if versus a more flexible environment. Yeah, that's really interesting. I never thought of that. Thank you for bringing that up.
um, another person, I think you mentioned that about like I was impressed
Yeah.
as I mentioned earlier. So they really appreciate your care path seems really neat. And their
Thank
question
you.
is like, how did you come to choose that path? You might reflect.
Yeah.
I found it really very interesting, and also you are very active and very responsive in every community that we had. I just
Thank
want to
you.
see what makes that path really clear.
Yeah. Thank you. Yeah. So my degree is so it's a joint PhD in rehab sciences, and then it's a master's of OT. So it works as you do 2 years strictly within your PhD, 2 years within the occupational therapy degree, and you're also supposed to be doing your PhD along with that, and then 1 year wrapping up your PhD. So it's a 5 year program. I kind of came into it because I really loved OT and I really wanted to work clinically. And I thought that there's just such value in working clinically. But I also just really loved the research that I was doing and wasn't really willing to give it up at that time. So I applied for the joint degree at Mac. I think Western also has one, and so does UBC. And then,
Mm.
yeah, able to work out. There's a few, if anyone is interested, I'm always happy to answer questions about the dual degree because there are a few logistics around it, which can be challenging, but I do think it's also a really interesting and cool opportunity.
I see that smart approach. I really appreciate that.
Yeah.
One interesting question on top of what I have asked you, actually, they have appreciated how you address the age,
Thank
the
you.
issue of age in that, but they want to know also if there are other aspects of uh, the factors that can be considered.
Yeah.
For example, they have mentioned that was there any difference with if they work longer, or if they had longer work experience or short work experience in terms of their brain fog symptoms?
Yeah, I don't know in terms of timing in the workplace, But I do know that we've had people who share that, they were in roles that were really all about inclusion and about support. So, like they were in those kind of um, don't remember the exact title of the roles, but they were like basically an inclusion kind of officer is what the term that they used. So obviously in that kind of workplace, there were a lot more supports and they did seem to be a lot more supported and seem to have better coping strategies because of this. So I don't know if it's something, it might be less to do with the timing of a workplace versus actually the kind of compassion and the culture that's actually within that workplace. And I think actually who your colleagues are and if they're able to provide that compassionate support actually does
Mhm.
make a huge difference.
Yes,
Yeah.
definitely. There are like I think, although I have seen the question from brain fog symptoms, there are two directions that we can observe this in terms of brain fog symptoms. There may or may not have a difference on the in terms of like the trajectory of what employment, for example. People might have
Mhm.
various types of employment experiences at different
Yes.
stages, so that their symptoms might vary. But
Yes,
the
that's
support
true.
system could also vary actually, depending when it is small or large scale. Definitely, the support system at workplace vary. There may be in a
Yes,
workplace where there is only 1% or 2%, and other than the person who's experiencing this health challenge. So that will
for
maybe
sure.
like diminish the available social support in the workplaces, and also the
For sure.
sometimes the workplace policies will vary when it is a large scale
Yes,
industry and a small scale industry. So I think
for sure. Yeah, that's
yeah,
absolutely
that would be
true.
one of our future
Yeah,
work
yeah, these are
activities. Yeah,
great future ideas. I'm really loving this. Thank you all for your questions
yeah,
and comments.
very interesting. Um, one one other question that I have. Did you observe any gap in terms of knowledge or practice that researchers or healthcare providers and workplaces should pay attention on these factors and support strategies from your like I like the way how you approach your study. You have a scoping review that will help
Mhm.
what are the available resources, what
Yeah.
has been done so far, and so that what are the key gaps that we have observed so that our early career researchers here can pay attention to research, to do more research.
Yeah.
If you have any student coming in this field, what do you advise that person to pursue?
Yeah. So I think the benefit is if you're coming into this field specifically, not a lot has been done. So you can really do kind of
Yeah.
anything, really anything. There's just so many gaps, especially when it comes to employment. Because they're really like even within our scoping review, really it's just looking at it within a health context, and people don't really actually look at it within employment. And I think that that's a huge missed opportunity because so many people experience chronic pain, and it's not just those. And sometimes when we think about it, we're thinking about people who are experiencing the most debilitating form of pain who maybe aren't working. But people typically, it might even be people that you work with, they also might be experiencing chronic pain. And without proper supports or without really thinking about how we can best accommodate them, then that can actually over time make pain worse. So I think it's really important for us to think about these different strategies about maybe what are some preventative measures, or maybe even just how can we get people with chronic pain back into the workplace, because some might also have a perception that employers won't be accommodating, so they won't even, they might be too scared or might be too discouraged to enter the workplace. So I think it's also encouraging people to re-enter it. So lots of opportunities if you'd like to enter this.
Opportunities.
Yeah.
Yeah, if anyone would like to further extend your conversation with Ronessa, I think she's very
Yes.
vibrant and open to
Yes,
extend
I would love if anyone has any questions, or even just has wants to have a discussion. I'm open at any time. I don't know, can I use the chat? I think I can use the chat. I'll just put my email in
yeah,
here.
actually,
Yeah,
use the
yeah.
chat.
Oh,
Yeah, to function. Yeah, there.
perfect. Yeah, I put my email there. So if anyone has any questions after the session, or you'd like to have another chat, or even if you have an idea, I'm really open to hearing it all. And again, as I said, I really think that it's through having these discussions and thinking about it in different ways that we can really help to kind of move the research forward.
Interesting. Probably we have some time to fill
Mm.
conversation. People are sometimes hesitant to disclose their health condition, particularly since it's linked to stigma and our workplaces. We have been mentioning some of the challenges that might affect their disclosure. Um,
Yes.
so what can workplaces do, like to create what needs to be done at workplaces to provide safer, more trusting workplace environment, so that people can get, unless they disclose, they will not. It's challenging, right? Disclosure is part of the research area actually that's coming. But what is your reflection
Yeah.
on this direction?
Yes. Well, I think, oh, sorry. Oh, sorry. I was just looking at the chat, but I think Therese put the email in. So I think we're all
Yeah.
good. But I'll just say, just in case, it's dassr5@mcmaster.ca. And then going back to your question around disclosure, I think that that's really interesting because I don't really know the best way to answer it, honestly, because disclosure is so tricky, and some people might not be comfortable with that because you never know how people will take it, or because there is that stigma out there. But I do think that nothing can be done unless we talk about it. So I think probably a lot more work has to be done in disclosure before I could make kind of any inputs on that. But I think that conversations and continuing conversations are really important.
Policy development in that area, and
Yeah, I'd
actual
love to.
building some actual support structure has to be in place so that people can get feel more safe to disclose
For sure,
and
absolutely.
request accommodation at workplaces. That would be one of the approach.
Yeah. I mean, ideally, what I kind of talk about with some of my committee members is ideally, you wouldn't have to need a disclosure, you wouldn't have to need an accommodation. People would just be able to get the supports that they need, um, because we all need supports in some sort of capacity. So that is what I would love to see in an ideal world.
Interesting. That was okay. We have one more question. Oh, two.
Yeah, that's an inbox. I'm
Oh,
sorry,
yeah.
I'm just reading from the Q&A.
Yeah, you can do
Yeah,
it. Yeah.
that's the thing, right? You're te technically people aren't supposed to use it against you, but they still might. So it's a really difficult situation.
It will be up to the individual actually until
Yeah,
we make sure that there is really strong support.
yeah.
And also, there has to be somehow, not only in terms of structural support or workplace accommodation, things like that. What will happen? How are we going to protect the employee if they are experiencing those negative impacts because of their
Mhm.
disclosure? It's not really fully addressed in
Yeah.
the in this system. So, having said that, as we begin to wrap up our session, Ronessa, I would love to ask you one final question. What is one takeaway? It was very interesting conversation here.
Mhm.
You provide us so much time to have this, to deep dive into this topic. What is one takeaway you hope workplace parties, the healthcare providers, and us researchers to remember from your talk today?
Yeah, I think one thing that I'll say is that I think that a lot of us might, or more people than we think, might be experiencing brain fog and chronic pain, but they might just be, sometimes people just might be hesitant to describe their experiences because they don't know how it will be perceived by others, kind of like what we've just talked about around disclosure. So I think it's really important for us to, us, if you're a healthcare professional or if you're an employer, to maybe take a proactive step to see what you can do to make either your patients, your clients, or your workers a bit more comfortable and supported in the workplace. And also, just at the end of the day, always showing that compassion and that flexibility. I think that those are really key things, no matter what you're experiencing.
Thank you. Thank you again for sharing your research, your insight, and it gave me personally, I've learned a lot
Thank
from
you.
this, from your work. And so,
Yeah, and think,
thank you for joining us today at this monthly series. And thank you, our audiences, for joining us today in our live session, and also for those who are going to watch or listen our recording at your convenience. We will appreciate your engagement. We really appreciate your engagement, and also we'd love to hear from you with various kinds of feedbacks. We hope this conversation encourage our collective effort to design more inclusive, accessible, and compassionate, and that you recommend compassionate pathways to implement for persons with disability, and also for those who are experiencing ongoing work disability due to various health challenges, including brain fog and chronic pain. And now we are closing our today's early career researcher talk session. feedback mechanisms. You will receive a survey after this session. You can also email to the IDEA National Office any feedback that you might have, and so that it can help us to improve for our future events. If you are interested to join us in our future talk, learn from IDEA website. However, I would like to tell you at this time that our next webinar will be, our next ECR talk will be on May 25th. We're going to announce that, so that please register and join us again to learn together. And for those who need a certificate of participation, please reach out to the IDEA National Office. They will give you a response. Thank you, everyone. And as always, let's continue to learn from each other and grow our community of early career researchers. Thank you.
Thank you all so much. I really appreciated all the questions and comments.